Hello, this is Dr. Arhiri, and today we're going to be discussing the topic of tooth extractions. The dental extraction is the removal of a tooth when that tooth cannot be saved anymore in somebody's mouth. Tooth extraction is necessary when the tooth is damaged beyond recuperation, basically beyond repair. Extractions can be simple extractions or can be surgical extractions. Those are a little more complicated. Now, normally wisdom teeth are always recommended to be extracted in most cases, unless the tooth is asymptomatic and does not bother the patient and it's a fairly decent position, then that wisdom tooth can stay in that position. When there is not enough space in somebody's mouth for the number of teeth they have, then certain teeth are required to be extracted first before the orthodontic treatment is completed. The teeth extraction on children are recommended when they're done sequentially according with the time when the permanent teeth are supposed to come in, and definitely fillings can be placed on baby teeth. When a tooth has too much bone loss and a lot of mobility, at that point the tooth cannot be saved anymore and needs to be extracted. Yes, all teeth extractions are considered part of oral surgery. Now, a simple extraction is when simply use elevators or forceps to just simply remove the tooth, versus when a tooth is ankylosed into the bone at that time, might require using a drill to release the bone around the tooth before that tooth can be removed. If you need the emergency tooth extraction, please feel free to call our office, Premier Smiles, at 610-647-7611. Normally, the teeth procedure, once the patient is anesthetized, most of the extractions, they don't last more than 1 or 2 minutes. Sometimes they can go over that, but most of them, it's usually a couple of minutes. If the teeth are other than the wisdom teeth, it is recommended to be replaced with an implant. It can be put to sleep or have conscious sedation as well, but most of the extractions can be done very atraumatically with just local anesthesia. For the first couple days, the patient needs to be careful in that particular area. He definitely should brush their teeth, the rest of the teeth vigorously, but when they get close to that area, to pay more attention and don't touch the particular area. Once the tooth is extracted, there is a set of rules which we hand every patient on a piece of paper that technically they're not allowed to drink to a straw. They should allow anything with seeds. They shouldn't do heavy exercise. They should brush their teeth but be very gentle in that area. When they rinse their mouth, they shouldn't squish the mouthwash in their mouth, just simply they should shake their head and let it trickle out of their mouth on the opposite side. It's not necessarily avoiding, it's just avoiding the area, because the blood clot can be dislodged. A dry socket sometimes can hurt more than the tooth extraction, than the tooth before, prior to the extraction. And what that is basically bacteria from somebody's mouth feeding off the blood clot, preventing from the blood clot to form, and that's what is causing that intense, constant pain. It should, normally the patient is advised to wait 2 or 3 days, enough for the blood clot to kind of totally form inside the socket, and after that the patient can go back to normal routine. The recovery is different from patient to patient, and it has to do a lot with the oral hygiene, diet, and basically their bodies. And whenever you have pain and you think a tooth is broken, feel free to give us a call at 610-647-7611. This is Dr. Arhiri with Premier Smiles.